Hello, home health friends and colleagues across the Gulf Coast and other parts of the country. I'm Warren Hebert. I'm with the Home Care Association of Louisiana, and here to talk with you a bit today, along with our guest, Chris Attaya, about the Gulf Coast Home Care Conference. The theme this year, out at Point Clear, Alabama, is Winds of Change, the Future of Care at Home. We have the good fortune of having Chris with us this morning. Chris, welcome. We're excited to have you.
Yeah, thank you, Warren. I appreciate to be able to be with you today.
Chris has many, many years in home health care. He's worked as CFO at the VNA of Boston, one of the largest VNAs in the country and one of the largest not-for-profits in home health across the country. Chris has also worked as CFO and later CEO with Partners Home Care. Partners is part of the Harvard Medical School affiliations. Chris, thanks so much. We're excited about your presentation at the conference, which is entitled A Deep Dive into the Data Behind Hospital Readmissions, Helping Agencies Reduce Rates Further. Chris, if you would, hit a couple of the high points there and let us know why it's going to be important for folks to hear you at Point Clear.
Well, clearly, that's what home care adds in terms of a value proposition, is helping hospitals with reducing rehospitalizations. As you know, rehospitalizations became part of Home Health Compare last July, but we don't actually see the rates. We just see that you're equal to, better, or worse than expected. And so what we're able to do with our SHP national database is produce a rehospitalization rate that we can then compare against different patient characteristics to help organizations understand why are they seeing rehospitalizations. So presentation, I'll be looking at things like patient age, looking at payer, looking at visit utilization, when visits are being provided, and how that influences rehospitalization rates. I do that by using correlations against the different OASIS data elements to kind of compare and look at that across the different types of characteristics. So it's pretty informative, and hopefully will help agencies understand a little bit more about what they should be looking out for when they have those patients be presented in front of them, and they know that these are some of the characteristics that are going to lead to higher rates.
Yeah, Chris, I'm sure you're seeing it in the organizations you're working with across the country, but we're seeing the vetting of home care providers by hospital systems. They're having a much closer look as to who they're partnering with. So obviously, the work that you're doing is going to help the home care providers to better prepare themselves for that challenge that certainly is part of home care's future.
Yeah, no question about it. If you think about hospitalizations themselves, they're part of the star ratings. They're now part of value-based purchasing in the 9 states. So it's an important element, keeping the costs low by keeping patients out of the hospital in the homes they want to be is very important. And hopefully you'll get some insights as to, again, what some of those characteristics are that are leading to higher rehospitalization rates.
Chris, thanks so much for spending time with us. For those of you that are watching who haven't yet registered for the Gulf Coast Home Care Conference, Point Clear, Alabama, the Grand Hotel is a great venue. There are lots of opportunities for networking there, not only with your home care colleagues, but the vendors and the speakers that will be there. We hope you join us July 27th to 29th at Point Clear, Alabama for the Gulf Coast Home Care Conference. I'm Warren Hebert. Thanks very much for being with us and hope to see you there.